In this video, we'll go over some example prescriptions, translate Sig codes, calculate day supplies, review some medications, and then we'll follow up with some questions about the scripts. If you haven't already, check out my other videos in the description below for a little background on the medications. We'll start off with a script from Dr. Peter Parker for 4 different medications. First, let's translate the Sig codes on the prescription. 1 cap POQHS is take 1 capsule by mouth every bedtime. 1 tab POQD is take 1 tablet by mouth every day. 1 tab POQPM is take 1 tablet by mouth every evening or every night. 1 tab POQAM is take 1 tablet by mouth every morning. Now let's move on to a few questions. What is the brand name for atomoxetine? Strattera is the brand name for atomoxetine. What are the indications for guanfacine? Guanfacine is FDA approved for the indications of ADHD and hypertension. What is the drug class for quetiapine? Quetiapine is an antipsychotic. What is the drug schedule for Concerta? Concerta is a Schedule II medication, meaning it has a high potential for misuse and abuse. What is wrong with this script? Your hint is that it has something to do with Concerta. Refills are not allowed on a C2 medication like Concerta. And a bonus question, what else is wrong with this script? It's not something you'd see very often, but it would likely be picked up by your pharmacy software system. Leave a comment below if you figure it out. Moving on to our next script, take a second to translate these Sig codes. Pause the video if you need to. The answers will pop up on the screen in a few seconds. So this one is take 1 tablet by mouth every morning and 2 tablets every evening. This is take 1 capsule by mouth 3 times a day, take 1 tablet by mouth 3 times a day as needed for acute stress and anxiety, and take 1 tablet by mouth every day. Now let's fill out the table. What is the brand name for topiramate? Topamax is the brand name for topiramate. How many capsules total of gabapentin were prescribed? So we have this fill here plus 3 refills, which is a total of 4 fills, and each fill is 90 capsules, so 4 times 90 is 360 capsules total. What is the generic name for Buspar? Buspirone. And I just want to point out that a lot of generic and brand names are pretty similar. Just looking at these two, topiramate and topamax, Buspar and buspirone. A lot of brand names are derived from the generic name. Check out the top 200 drugs list in the description below to see a few more examples and other helpful tips for memorization. And last question, what is the indication for Mercet? Mercet is used for contraception. On to the next one, translate the Sig codes on the script. Take a second to think them through in your head or write them out and pause the video if needed. Now let's calculate the day supply for all medications. Starting with albuterol, if they're using the inhaler, the max amount according to the directions, then it's 2 puffs every 4 hours. There are 24 hours in a day divided by 4, which is 6, so they could use 2 puffs up to 6 times a day for a max of 12 puffs a day. There are 200 puffs in every inhaler, so 200 divided by 12 is about a 16-day supply. For Tessalon pearls, they're given 20 capsules, and they're taking 1 3 times a day, so 20 divided by 3 is about a 7-day supply. For Cefuroxime, they're taking 1 tab twice a day for 5 days. This one is given in the directions, but let's double check. 10 tablets divided by 2 for twice a day dosing is 5, so that checks out. For prednisone, they're taking 2 tablets every day for 2 days, then 1 tablet every day for 3 days. That comes out to a 5-day supply. And for Pulmicort, they're taking 2 puffs twice a day, so max 4 puffs a day. There are 120 puffs in every inhaler, so 120 divided by 4 is a 30-day supply. Now let's move on to some questions. What are the brand names for albuterol? Ventolin, ProAir, and Proventil are the brand names for albuterol. What is the generic name for Tessalon pearls? Benzonatate. What is the indication for cefuroxime? Bacterial infections. Calculate the QS, or quantity sufficient for prednisone. Sometimes you'll receive scripts where the provider left out the quantity and they write QS, which means that they want you to give the patient enough medication to complete the duration of therapy that they prescribed for. So looking at this prednisone script, they're taking 2 tabs daily for 2 days, which is 4, plus 1 tab daily for 3 days, for a total of 7 tablets. What is the generic name for Pulmicort? And the generic name for Pulmicort is budesonide. Our next one is a typical script you might see following many minor surgeries or procedures, especially in the outpatient setting. We have some antibiotics, some pain medications, baby aspirin, and something for constipation. So take a second to translate these Sig codes. Now calculate the day supply. Pause the video if you need a second. For most medications, you'll generally want to round up on the day supply, especially for controlled medications, but sometimes you can round down depending on insurance limitations. Moving on to the table, what is the indication for doxycycline? Doxycycline is used for bacterial infections. What is the brand name for hydrocodone with acetaminophen? Norco. What is the generic name for Ultram? Tramadol. What is the indication for Sena Plus? Constipation. And which of these medications are controlled substances? Tramadol and Norco are controlled substances. In this script, we're given a list of maintenance medications. For this one, the provider left off the dosage form of whether it's a tablet or capsule. Most software systems auto-populate that part when you type in the Sig, but it turns out all these medications come in a tablet dosage form. So take a second to work out these Sig codes. Now let's fill out the blank spaces in the table. Pause the video to work them out, and the answers will appear shortly. And on to some questions. Name another beta blocker like atenolol. Bisoprolol, carvedilol, labetalol, metoprolol, and propranolol are a few other beta blockers. Beta blockers can be recognized by their olol stem. Carvedilol and labetalol have slightly different stems, but they are still considered beta blockers. Name another sulfonylurea like glipizide. The 3 main sulfonylureas are the 3 Gs: glipizide, glimepiride, and gliburide. Name another proton pump inhibitor like pantoprazole. Dexlansoprazole, esomeprazole, lansoprazole, omeprazole, and rabeprazole are a few examples. Proton pump inhibitors can be identified by their prazole stem. Here's a typical script for a patient in hospice who might be receiving palliative care. Take a second to work out these Sig codes. Take another second to calculate these day supplies. And then fill out the blank spaces in the table. Name another cephalosporin like cefuroxime. Cefazolin, ceftonir, ceftriaxone, and cephalexin are a few other cephalosporins. They have a ceph stem. Name another benzodiazepine like lorazepam. Alprazolam, clonazepam, diazepam, midazolam, and temazepam are a few other benzos. Most benzos have the stem azolam or azepam. And last question here, name another opioid like morphine. Hydrocodone, oxycodone, fentanyl, tramadol, and codeine are a few other opioids. Here's another one. You'll want to take a moment to pause the video and work these out before the solution pops up on the screen. So first, let's translate the Sig codes on the prescription. Then let's calculate the day supply for all medications. And fill out the blank spaces in the table. Finally, let's calculate the QS for prednisone. This is similar to the previous prednisone script, but the directions are a bit more drawn out. When you have a really long taper, it helps to make a table with a column for dose, frequency, and duration. Fill it out according to the directions and you get something like this. So this is saying first take 40 mg or 4 tablets because we're using 10 milligram tablets twice daily or a multiplication factor of 2 for 2 days. So 4 times 2 times 2 is 16. And then we'll be taking 4 tablets daily for 3 days, which is 4 times 3 comes out to 12, and so on and so on. And then you add up the totals for a quantity sufficient of 37 tablets. Here's a script with a few different dosage forms. Let's start off with translating the Sig codes. For Medrol and Z-Pak, there are slight variations in the directions depending on your pharmacy and software, but for the most part, they would look something like this if they're called in as dose packs with the instructions used as directed. This is what your typical Medrol dose pack looks like, and this is a Z-Pak. Now let's calculate the day supply for all the medications. When calculating the day supply for eye drops or ear drops, you can assume that 1 drop is equal to 20 milliliters, but some people prefer using 15 or 16 drops in a milliliter. In these examples, I've used 20 drops in a milliliter. When figuring out the day supply for topicals like creams and ointments, the rule of thumb, or maybe I should say rule of finger, is the fingertip unit, or FTU. 1 FTU is half a gram and is measured as the amount of medication that covers the tip of an adult finger to the first crease. 1 FTU is enough medication to cover both sides of your hand, but because we often don't know the size or area the patient is applying the medication, we have to take our best guess. With smaller packages like 15 to 30 grams, generally 1 application is 1 FTU, so BID dosing would be 1 gram a day. And then when you're calculating the day supply for insulin, first find out how many total units are being dispensed. So if there's 300 units or 3 milliliters in every pen, then that's the same as 100 units per 1 mil. We're giving the patient 15 milliliters, so 15 times 100 is 1500 units total. 1500 divided by 16 is 93.75, but round down to 90 because most insurance plans won't cover more than a 90-day supply. And for nitro, I usually default to a 30-day supply because the patient shouldn't be using it daily, otherwise they should be taking something else for chest pain prophylaxis. Now let's fill out the table. And a few questions. Name another HMG-CoA reductase inhibitor like Lipitor. Lovastatin, pitavastatin, pravastatin, rosuvastatin, and simvastatin are all HMG-CoA reductase inhibitors. They can be identified by their vastatin stem. And finally, is basiglar rapid-acting, short-acting, or long-acting? Basiglar is long-acting. Here we have a script from Barry Allen, Doctor of Dental Surgery. He sent in some antibiotics, pain meds, and an antiseptic mouthwash. Take a second to translate these Sig codes. Now work out the day supplies. And then fill out the blank spaces in the table. And then we have a few questions. Name another penicillin antibiotic. Amoxicillin, ampicillin, piperacillin, and dicloxacillin are a few other penicillins. They can be recognized by the cillin stem. Name another non-steroidal anti-inflammatory drug. Ketorolac, meloxicam, naproxen, diclofenac, and celecoxib are a few other NSAIDs. How many mils are there in a teaspoon? What about a tablespoon and an ounce? There are 5 milliliters in a teaspoon, 15 milliliters in a tablespoon, and 30 milliliters in an ounce. So suppose the patient got home but had no way of measuring 15 milliliters. You could tell them it's 3 teaspoons, 1 tablespoon, or half an ounce. Here we have a script with all your diabetic testing supplies. There's some insulins, another agent for blood glucose control, strips, lancets, a meter, pen needles for the Lantus and Victoza pens, and syringes for drawing up the Novolog from the vials. So first, let's start off by translating the Sig codes in the prescription. Then let's calculate the day supply for all these medications. And finally, let's fill out the blank spaces in the table. And moving on to a few questions, is Lantus rapid-acting, short-acting, or long-acting? Lantus is a long-acting insulin. What about Novolog? Novolog is rapid-acting. Here's a little guide to help with your insulins. There are a lot of takeaways about the composition or action of the insulin just by looking at the names. For example, Phi-Asp is the brand name for insulin aspart. Or if you take the R in Apidra and move it to the front, you get Rapida, referring to rapid-acting insulin. And with regular insulin, the R is carried over in the brand names Novolin R and Humalog R, and it's a regular-acting insulin. NPH, the N is carried over in the brand names, and it's a intermediate-acting insulin. Glargine and basiglar. Basiglar is a basal insulin, which you can think of as long-acting. All the analogs or logs are rapid-acting, kind of how like the logarithmic scale increases so rapidly. Humalog is a human insulin, meaning it's a synthetic version as opposed to those being derived from animal sources. Admelog is another analog insulin that has a modified amino acid composition resulting in altered ADME, which is a common abbreviation in pharmacy short for administration, distribution, metabolism, and excretion. Novolog is an analog insulin manufactured by Novo Nordisk. Lantus, emphasis on the LA for long-acting. Detamir and Levemir. I like to remember the long-acting insulins using the acronym BLT, so Basiglar, Lantus, Levemir, Tresiba, and Toujeo. The exception to that is Lispro and Lumjev. The generic names of each insulin also tells you a lot about the amino acid composition. So looking back at these questions, Lantus, LA, for long-acting, and Novolog is rapid-acting, like how a mathematical log function, or the pH scale, increases rapidly. Here's another script with a list of maintenance medications, but instead of translating the Sig codes, this time let's change the directions into Sig codes. For example, take 1 tablet by mouth every 6 hours as needed for anxiety is 1 tab PO Q6H PRN for anxiety. This is 1 cap PO before breakfast, 1 tab PO QHS, 2 tab PO TID, and so on. So take a second to look these over, and then let's fill out the blank spaces in the table. And onto a few questions. Which of these medications are controlled substances? Alprazolam, phentermine, and zolpidem are controlled substances. On to the next one. Take a second to write out the directions for these Sig codes. Sometimes the prescriber will give the dosing in a strength such as 1 gram or 120 mg, but you'll want to write out the directions in terms of number of tablets or milliliters so it's easier for the patient to follow. So with that in mind, translate these Sig codes. So it should look a little something like this. Instead of 1 gram, you say 1 tablet, or instead of 4 milligrams, it's 1 tablet. Now let's calculate the day supply for all these medications. And finally, let's fill out those blank spaces in this table. And then moving on to a few questions, which 2 medications are a duplicate therapy? Robaxin and Xanaflex are both muscle relaxants, so they would be considered a duplicate therapy. Name another muscle relaxant. Carisoprodol, cyclobenzaprine, metaxalone, baclofen, and chlorzoxazone are all different types of muscle relaxants. Moving on to the next one, translate these directions into Sig codes. Then calculate the day supply for all these medications. And finally, fill out the blank spaces in this table. Moving on to a few questions, name another histamine H1 antagonist like Zyrtec or Estelin. Promethazine, hydroxyzine, loratadine, diphenhydramine, olopatadine, and fexofenadine are a few other histamine H1 antagonists. And would you dispense 75 or 100 milliliters of amoxicillin? To figure out which package size you would dispense, we first want to find out how many milliliters total they would need to finish the course of therapy. You can do this by finding how many milliliters they're taking for every dose and multiply that by the total number of doses. Every dose is 510 milligrams, or if you convert that to milliliters, it's 6.375 milliliters, 6.4 milliliters rounded up. So you get 6.375 milliliters every 12 hours or twice a day for 6 days, which comes out to a total of 76.5 milliliters. You might think that 75 milliliters would suffice, but in most cases it's better to have excess. A lot of antibiotics are dosed by weight with specific guidelines on how to dose based on indication. So if you dispense less than prescribed, the patient wouldn't finish their entire course of therapy, and there's a possibility they don't completely recover from the infection, and there's a chance to create antibiotic resistance. Some people might argue that 75 milliliters would be sufficient, but my take is that you would dispense 100 milliliters and discard the remainder. In very few instances would you actually dispense less than what the provider wrote for. Especially in the case of antibiotics, it's better to play it safe. You would also want to change the directions to reflect a milliliter amount, so it should read, take 6.4 milliliters by mouth every 12 hours for 6 days, discard remaining medication. Okay, you guys know the deal, so translate the Sig codes on this prescription. Then work out those day supplies. And let's finish out strong and fill in these blank spaces in this table. And finally, the last question, calculate the QS, or quantity sufficient for warfarin. This one is a little tricky, but if you make a table like this, it makes it much easier. It looks like they should be taking 11 tablets a week, but if you move on to the next week, you see that they're taking 10 tabs in the next week. So it turns out they're taking on average 10.5 tablets a week. A 12-week supply is 84 days, so 10.5 times 12 is 126 tabs. Alright, that's all for this video. As always, thanks for watching. Leave a comment if you have any questions, give me a thumbs up if you enjoyed the video, and subscribe if you haven't already. Also, check out the other videos for more pharmacy related content.